Hello, everyone. You are most welcome. We will start now, but let's wait a little bit because we're just open the Zoom room to allow time for everyone to join before we get started. All right, welcome again. Welcome here. Thank you for being with us, and welcome to the 12th session of a series of webinars of the Social Compass by ILO in partnership with socialprotection.org. Today's session is the right to social security in the Arab region, insights from the OHCHR ILO Factsheet. Before I give the floor to Marielle Bourzad from the ILO, I just would like to highlight certain logistics and housekeeping rules just to make sure that you're able to listen to the opening remarks by Marielle in a clear manner and in the most convenient language. First, this session is being recorded. The recordings will be available on socialprotection.org and the website, the ILO website at a later stage, and it will be shared with the registrants after this session. There will be two types of interpretation. The closed captions. This is, of course, Zoom AI generated. When you click in the CC button, you can, of course, see the closed captions. And we have also the simultaneous interpretation, English into Arabic and vice versa. Through the Zoom controls at the bottom of the screen, you click interpretation and select the language that you would like to hear. Before further ado, let me give the floor to my colleague Marielle Bourzad, who is the regional social protection specialist for the North and the Horn of Africa. And the floor is yours for the opening remarks before we start. Marielle, go ahead. Marielle, will you speak in English?
Thank you, Farah, and thank you to all of you who are joining us today. On behalf of the teams at ILO and ISA, we are happy to present this 12th episode of the Arab Social Protection Compass on the right to social security in the Arab region, insight from the OHCHR ILO Factsheet. Our special thanks to socialprotection.org for hosting this webinar, to all the ISA and ILO colleagues, and of course to OHCHR in preparing this specific episode. Last but not least, a special welcome as well to the ISA member institutions who are joining us from the region and beyond. We are proud to have delivered together 12 webinars under the Arab Social Protection Compass. The space has grown from an idea to an emerging hub of knowledge on the latest development in social protection in countries across the MENA region. As I have said, today's focus is on human rights. The right to social security, as you know, is a fundamental human right and also a cornerstone of human dignity and social justice. It should be guaranteed throughout the life cycle through rights and legal entitlements and their actual operationalization so that everyone can access at least a basic level of protection when risks arise and without any discrimination. The joint OHCHR ILO Factsheet on the right to social security offer this practical guidance on what this right actually entails in practice and how it can be progressively realized through a coherent and right-based system. So we have been encouraged by the growing embrace of a right-based approach in the MENA region, and we very much look forward to hearing today's intervention from our distinguished speakers. So warm welcome to all of them, starting with Narmin Mohamed, a human rights officer at OHCHR. We also have Medard Rashid, a socio-economic empowerment consultant at the Ministry of Social Solidarity in Egypt. Hadia Al-Marouki, General Manager of Social Protection Policies at the Social Protection Fund in Oman. And Ibrahim Abdallah, President of the Lebanese University Leagues of the Blind and a member of the National Council on Disability in Lebanon. My apologies if I mispronounced your names. With that, I will now hand to our moderator, Farah Al-Shami from the Arab Reform Initiative, who has graciously accepted to take you through this online session. I wish you all an excellent webinar. Thank you very much.
Thank you so much, Marielle. Let's start our session. Yes, so we will get started today. Before we start, let me just highlight two quick points. Number one, you can use the chat box to present yourself. I've seen that you've already started presenting yourselves. And this space is available for you to present yourself, to make comments, and to share any useful links with the audience. There is another box, the Q&A box. So please use this box for questions that you'd like to address or that you'd like to ask to the speakers in today's session. And when you share your questions, please put the questions on the Q&A box. Just use the Q&A box for questions, not the chat box. For the chat box, just present yourself, the organization you belong to, and then for the questions, the question whom you're addressing the person whom you're addressing the question to. And in the Q&A, we'll try to answer all of your questions, either in writing or verbally during the discussion time, Q&A time. A quick note before we officially kickstart the session. Let me tell you that we have two interaction moments before the panel discussion. There will be an interaction moment immediately prior to the presentation by the OHCHR, and then after the presentation, we'll have another interaction moment. Let me now initiate the first interaction moment. I don't want to add much to what Maria just mentioned about this series. Of course, this series organized by the International Labour Organization in cooperation with socialprotection.org intends to put a spotlight on the inclusive social protection and the right to social security, how to present a social protection that is inclusive and that guarantees protection to all vulnerable communities, that is sustainable and adequate to guarantee a certain level of decent social protection to all beneficiaries with no exception, both the nationals and the residents. It aims at also bridging the gap between the different actors, the practitioners, the policymakers, the beneficiaries, and the civil society organizations. Today's session had been introduced by my colleague Marielle, and we would like, of course, to learn about the progress in Oman, Egypt, and Lebanon's three regional contexts, especially that there's been a great progress made in going towards an inclusive and right-based approach for social protection. Accordingly, based on the OHCHR ILO fact sheet, we're interested in looking into the latest developments, the challenges that have been encountered, as well as the steps that need to be taken for the legislations to be fully enforced and also to see the light. The ultimate objective of this session and the entire episode is to bridge the gap not only between the different actors and the different approaches, but also to fill the gap between the international human rights standards, the social security standards, and the implementation at the country level, especially that the gap is wide, and this is usually called the legalization of social protection. We promulgate laws and legislations, but we're faced with political, economic, and financial challenges, amongst others. With this session, our webinar will try to fill in the gap. The right to Social Security is instrumental. We will see how we can make it happen, especially that it appears in the Declaration, the Universal Declaration on Human Rights, and clauses 22, 25, and other conventions such as the ILO Convention 102 and the ILO Recommendation 202. Before I initiate the first interaction moment, again, I would like to very quickly introduce our speakers. I am the Senior Fellow and Program Director, Social Protection at the Arab Reform Initiative. We have with us Nermeen Mohammed, who is the Human Rights Officer at the OHCHR, the UN OHCHR. She will be presenting the fact sheet, the OHCHR ILO fact sheet. Before we start the discussion, we have three other speakers. Mr. Medhat Abdel Rashid, he's the socio-economic empowerment consultant at the Ministry of Social Security. We have Mrs. Radia Al-Mahrouki, General Manager of Social Protection Policies at the Social Protection Fund in Oman. Last but not least, Mr. Ibrahim Abdullah, who's the President of the Lebanese Universities League of the Blind and member of the National Council on Disability in Lebanon. The first interaction moment, that is the right moment. It's a question, actually, that is asked to all of the attendees, all of the listeners. In order to answer the question, please scan the barcode, the QR code, or the link that you can see now in the chat box. You can either scan the code or click on the link. Let's take 1 minute to answer the question. The question is, how would you describe the current state of the right to Social Security in your country or your context? And this is a quick multiple choice question. Please let's all answer the question to try and see what's your opinion as to the current state of the right to Social Security in the different countries and contexts. We'll give you enough time to join the poll and give an answer. When the colleagues are ready to present your answers, we will all together get to see what answers you've given to the question, or what are the most common answers. Hold on a second. So the two most common answers, the partially applied with significant gaps in coverage or adequacy. And then another answer, well established in law and practice, though still evolving. There is another question that is starting to appear. No, actually, it's one person who had given this answer. It's a largely legal principle with limited application. A largely legal principle with limited application. Yes, we see that absolutely in different contexts. And we sometimes see that when implemented, is well implemented. It can be partially implemented, maybe because of certain challenges that prevent a full-fledged implementation. The ultimate aim is for it to be implemented altogether, but we see that it is partially implemented. It improves with time, or it remains partially implemented, and it might not be totally inclusive. And here I am pleased to see that some people do perceive it as a well-established right and law and practice, even if it's still evolving. Most importantly, all of the actors, both beneficiaries, policy makers, media presenters, practitioners, activists, academicians, and civil society participants, their perception of the social security as a right and as a part of the social contract that links the citizens to the state is a starting point, and this is very essential. If this is guaranteed, then this well-established right and law would also be fully materialized in practice. And that is to respond to the first interaction moment. Just let me tell you that there is a partial implementation in many cases. Sometimes the partial implementation might be considered as intentional, or it might not be intentional. There might be a progressive realization or a partial implementation, gradual implementation of a certain plan for a specific time, or when there are financial challenges, other challenges and economic challenges, it might be a partial implementation. Sometimes it is intentionally partial because of political, economic, or demographic considerations. Let's stop here now with the first interaction moment, and let me give the floor to the first speaker in today's webinar, Mrs. Nermeen Muhammad, from the OHCHR, the Human Rights Officer. Nermeen, the floor is yours. We are all ears. Thank you so much, Farah. Let me share my screen. Yes, go ahead, Narmeen. I just wanted to tell you that Narmeen will give us a quick presentation on the content of the OHCHR ILO fact sheet. So for those of you who didn't have enough time to read it prior to the webinar, it's your opportunity to learn more about it. Hello, Ramadan Mubarak, everyone. I will present the fact sheet on the right to Social Security. Can you see my screen? Not yet. Yes, once, yes, 1 second. Yeah, I can see it. As I've told you, I will present the fact sheet on the right to Social Security. And the first point, as mentioned by Farah, this fact sheet comes as a result of joint efforts between the OHCHR and the ILO, the International Labour Organization. The objective is to explain and present the content of the right to Social Security, its main components, as well as the commitments and obligations according to the Universal Declaration on Human Rights and the International Labor Standards. It also provides practical guidance to help countries develop inclusive and sustainable social protection schemes that could address the challenges, inclusive and sustainable, to benefit the current and the future generations. When we look at the definition of the Social Security, as you all know, it is about making available the access to all individuals, all citizens, and all groups to the primary health care and safety, especially when they encounter social risks and contingencies during the life cycle. When we look at emergencies and contingencies that individuals and groups might be faced with, we have, for example, maternity, childbirth, the family support, health care, illness, old age, unemployment, occupational injuries, as well as the case of successors and orphans. Here we have the international standards on the right to Social Security. Farah had explained how it got codified in international conventions. We have a lot of international standards on human rights and labor that provide for the right to Social Security and the right of every person and individual to enjoy this right. First, in 1944, the first document spoke about the main components of the right to Social Security was the Philadelphia Convention, and then the Convention uh, 102, which is a reference for most of the countries, and a lot of countries now, 70 years after, still consider it a reference or a benchmark to adopt these schemes at the national level. We have the Universal Declaration on Human Rights that provides explicitly for the right to Social Security, and there are a lot of international conventions on human rights that provide for the right to Social Security. Most importantly, the International Covenant on the Economic, Social, and Cultural Rights, Article 9, speaks about the importance to enjoy the right to Social Security. And as you can see, there are many other conventions that speak about the right to Social Security, such as the Convention on the Racial Discrimination on the People with Disabilities, the CEDAW, the Convention on the Rights of the Migrant Workers, as well as many conventions of the ILO, such as also the recommendation of the Social Platform, the Occupational Injuries Benefits, the Disability, Old Age, and Successors Benefit, the health care, the also social security rights, employment, and protection against unemployment, the maternity conventions. And I would like to tell you that it establishes actually a strategy on how to have access to an inclusive social security through two pillars, having access to the basic income and the basic health care, then working progressively to achieve the inclusive social security by increasing the coverage to include more groups and categories. Those are the international standards that provide for the right to Social Security and guarantee the protection of this right. Let us see together what we can find in the fact sheet in terms of the essential elements of the right. One of the essential elements and one of the first elements is the legal and political framework. And here we mean how to codify the right at the national level. And when we speak, for example, about a country that ratified the Covenant on the Social, Economic, and Cultural Rights, or the ILO Convention 102, then the country must codify the conventions at the country level by promulgating legislations consecrating the rights in the Constitution, then the legislations that would guarantee the right to Social Security, all of the hindrances and articles that limit the right to social security must be abolished, or those that provide for discrimination in terms of accessibility. So the legislative and political framework is one of the essential elements of the right to social security. Second element is having social security schemes that are diverse. There should be, for example, contributory schemes uh, so that workers, employers, and the state contribute to the social security, while the workers would be the end beneficiaries. That is for workers in companies or in the public sector, as well as non-contributory schemes. What do we mean by non-contributory schemes? Those are the schemes where the state has the largest share, either through revenues or a taxation percentage for investment in these social security schemes. And the non-contributory schemes are always, for example, essential, such as the social insurance. They always focus on the vulnerable and marginalized individuals, the least poor families, the poorest individuals, the poorest individuals, the workers in the informal sector, the persons with disability, and persons in need of contributory or non-contributory, in this case, non-contributory schemes. And there are also other schemes such as the social protection schemes or sectors that would contribute to the uh, social security at the country level. And there are other also social schemes. The third element is the social risks and emergencies. As I've told you, in the case of unemployment, illness, old age, disability, maternity, and illness. These are emergencies and contingencies that would require a social security scheme that would enable the individual really to overcome the challenges and the risks. Here to the right-hand side, you see standards. They are also essential elements of this right. And we have the economic, political, economic, and cultural rights committee. This is a mechanism that identifies cultural and economic rights in order to assess the extent to which the country is committed to the rights, as well as the fulfillment of the commitments. So this committee had issued the so-called general comment. The general comment explains the right to social security and established specific standards through which we can know whether the human right based, whether the human right based schemes are well established. First, the social security schemes must be available across all of the regions and remote, distant areas, and individuals must have access to such places. And there should be also contributory and non-contributory schemes available. And there should be also the element of adequacy. What do we mean by adequacy in terms of the level? I mean, whether it's monetary or in kind, it should be adequate so that the individual or the family can live a dignified life. They can have access to decent housing, food, and other rights, water, health care, as well as education and access to work. It should be adequate to allow a dignified life. It should be sustainable in order to allow the individual to really have economic independency and autonomy. It should be adequate and time-bound. I mean, if an individual is too poor, he or she can overcome poverty. Number three, the accessibility. So other than the availability, we have the accessibility, and here we look into different elements. Number one, the eligibility. Nermin, I am sorry to interrupt. Please, in 2 minutes, try to conclude. All right. Thank you. The accessibility, the financial access, and the participation, the engagement of the workers and the workers' unions and the social security policies.
Which means that they should not restrict this right. And by protection, I mean that they should protect the citizens from private enterprise, for example, or any other individual that does not respect this right or violates this right. And we've also talked about the importance of having clear legislations and execution mechanisms. As Farah said in the beginning, it is about gradual work in order to reach comprehensive social security. It's also important to have a non-discrimination criteria, which means an immediate commitment that includes everyone. And there should be also a basic minimum, which is a guarantee of basic income and basic health care. And there should be also accountability and transparency. And also, excuse me for speaking very quickly, but we need also to have social security systems based on human rights. This is very important to have such systems. We need to have strong legislations and policies. We need to have also enough references offered by the state. These systems must be gender responsive, which means that they strengthen gender equality, especially in the Arab region and in our countries, because most women do not, or actually a large number of women do not work. So these social security systems should take into consideration this gender criteria. And also they should be developed and built for all and give special attention to disadvantaged individuals and groups. They should establish poverty reduction intervention within human rights standards and principles and improve monitoring to make evidence-based decisions. And there should be also effective mechanisms for fairness and accountability. If such mechanisms do not exist, and then we will not be able to ensure such systems. These mechanisms are very important. And then I've ended my presentation. Thank you very much for listening. Over to you, Farah, and very sorry for taking much of your time. Not at all. It was very difficult to ask you to stop. Your presentation was very interesting. Thank you very much, Nermin. Before moving to the discussion panel, let us dedicate 2 minutes for our second interaction moment. Please show the barcode. We will not take much of your time here because we need to listen to the other speakers. Our question is, what is the biggest challenge in advancing a rights-based social protection system in your country? So please, you can either scan the barcode through your mobile phones, or you can log in the link that we just posted in the chat box. I will give you all 20 seconds or 30 seconds to answer, and then we will see the answers together. And when the other speakers will start their intervention, we will see to which extent this vision that you have as an audience is true or not. I mean, will it be common among the three countries or not? So the results were as follows. The first answer was addressing the complexities of extending coverage to everyone, including workers in the informal economy and their families. Of course, this is a problem. The informal economy is very large in the Arab countries, especially in countries such as Egypt and Lebanon, even though their economic system are different, and Tunisia as well. So this is very understandable. The second answer is to ensure financial sustainability and secure funding for universal coverage. Yes, this is one of the main challenges. However, when the political will is present, then we see that things starts to find their way to a solution. For example, we can see some debt restructuring or tax reforms in a way to allow for social protection. So yes, there are solutions, but of course, this is one of the challenges. The second or third challenge is strengthening coordination, governance, and participatory policy making. Indeed, this participatory approach is a bit shy in this region, and we have also political economy problems, governance-related problems, also management information system problems within governmental institutions because they are still not very evolved. We have problems related to data and data complementarity because these problems, if resolved, can help us find more comprehensive social protection. The last answer that only had one participant selected is embedding the right to social security in national legislation in a manner that allows for implementation in practice. Yes, in some countries, the challenge is at the level of legislation, not at the level of execution. It exists in some contexts, even though we're now witnessing that the contrary is rampant in the region, that there are some laws, but they are not being executed. Now, the one answer that did not receive any selection is maintaining high-level political commitment across leadership changes. This is very dynamic, so I understand why you didn't select it. Okay, so thank you very much. And now let's move to the discussion panel. We will start with the Egyptian case with Mr. Midhat. I will reintroduce you very quickly and ask you a question. You are Midhat Abdel Rashid. You are a consultant in economic and social empowerment in the Social Solidarity Ministry in Egypt. So Egypt achieved achievements when it comes to having a comprehensive social protection system. So we would like to hear from you. What are the main elements of this framework, especially those that established the social protection as a right and not as an assistance? So, what do you think was the most important to translate these legal texts to tangible social protection? Go ahead, you have 5 minutes. Hello, Mrs. Farah, and hello to everyone. I'm very happy to be among you today. I am at the Ministry of Social Solidarity as a consultant of economic and social empowerment. I've been working with the ministry for 6 years. We always exchange our expertise regarding this matter. We have been informed of many models and systems. I would like to say at first that uh, in Egypt, while preparing for this for a presentation, because I was on a peer exchange mission, so I started to prepare, and I was surprised to see that even in the days of the pharaohs, they talked about social protection. It really struck me because this notion was already established. Of course, today the times have changed, but what we're talking about today and what Egypt managed to be achieved was not achieved overnight. It happened throughout the years. Since 2014, we have been looking towards achieving governance of social protection and empowerment. This was one of our main issues. So this starts within our constitution. It's very clear that we have two articles. Article 17 of the 2017 modified the Constitution and Article 18. These two articles talk about the right of social protection. And of course, the Constitution is the fundamental text from which legislations are drafted. And so this led to legislative fundamental principles that we worked on, the most important of which, and the one that we're all happy and pleased with, is the law number 20 of 2025. Indeed, we were preparing for sessions to prepare this executive regulation. And we all felt that we were opening a new page in which we were strengthening the importance of protection and adopting the human rights approach as a main working approach. Of course, this regardless of any other efforts that were already deployed on the ground. You know that the civil society in Egypt have been working since 1938. Nevertheless, it was all about good intention efforts and good practices. However, to move in to transform all this into a legislation and a law, it was really considered a great accomplishment for the citizens of Egypt. So this law, law number 12, is the most comprehensive, but we also have law number 10 of 2018 on the persons with disabilities. It includes many details. And I believe that the National Council of People with Disabilities have greatly contributed to that. We have also law number 2 on the comprehensive health insurance or health care. Which entails that healthcare should be offered based on a human rights approach, and it was implemented in several governorates at first, and then it included 2 more governorates. We also have another law that was issued in 2017 that talked about the extending of the legal coverage. It talked about self-registration and health insurance, raising the awareness also. So this was very quickly the legislative framework of our journey. And I'm very happy that this is in alignment with what we're talking about today. I'm very happy to talk about our achievement in Egypt, because now we do have a governance framework, and we moved from initiatives, even if they were just ministerial initiatives. So we moved from the level of initiatives to real achievements on the ground. So now we have a law and a legislation that are truly organized. What I want to say as well is that we also moved from gaps that were present in previous legislations. Indeed, this accumulation of our expertise in execution helped us have a comprehensive law. Indeed, we already used to practice this on the ground. So when we had the opportunity to have a legislation, we managed to have a truly comprehensive legislation. What's also very... Can this be, please, your last point, if you please? Yes. So if the economic empowerment is now part and parcel of this legislation, and if we have another opportunity, we will talk about it. So we have a strong legislative framework, and we add to that economic empowerment. Thank you very much, and thank you for abiding by the time. And let us move to our second speaker, Mrs. Radia Al-Makhlouki, Director General of the Ministry of Social Affairs in Oman. Mrs. Radia, we are all excited to listen to you because Oman witnessed in the recent years great progress, and it was a pioneer in having a comprehensive healthcare system or social protection system. So how do you describe the process of Oman, sorry, and what were the main stations or milestones that helped you move to a more comprehensive and system? And also, please talk to us about your practical experiment. And this is why, please tell us more about the lessons learned and the success stories that can be useful to us in the Arab region. This will also be useful to us in having a more comprehensive systems. Please go ahead. You have 5 minutes.
Thank you, Farah. Allow me to express my thanks to the ILO and the socialprotection.org for organizing this virtual webinar. I am here to represent the Sultanate of Oman Social Protection Fund, and within this short time, as you mentioned, in 5 minutes, I will try to go through the main elements of a transition that we've seen in the social protection scheme, as you perfectly mentioned, in the last 2 years. And it was based on the legislative layer design and a design that covers most of the life cycle risks. This didn't come out of scratch. Actually, we've been relying on guidance. I will not start with the legal and legislative guidance, but with a national guidance, which is the political will for the social protection transition, the Oman Vision 2040, which gives an essential focus on the dignified life for everyone. This priority also includes 6 objectives that focus on the social protection and having a society that enjoys sustainability, justice, and competence, targeting also the most needy individuals for social and economic empowerment. With the initiation of the vision, the Sultani decree had been the starting point for the social protection scheme in July 2023, and in July 2023, the social protection law and the social protection fund law had been promulgated. In the same year, the executive decree of the social protection law had been established. In January 2024, we did start implementing the social protection scheme. The social protection law is also, of course, based on international standards with strategic partners from the ILO, the UNICEF, and the SDGs, as well as many other standards that support the social protection system. We've also looked into the best practices. Under the challenges here in the Sultanate of Oman, we didn't only have challenges, but those were also opportunities to change and to transform. We've had different funds with different pension schemes with limited coverage to certain categories, and there was a big margin of error in the targeting because that was based on the case studies. There were also gaps between a different targeting standards. Now this is more efficient of a lowest cost. It guarantees sustainability. It guarantees dignified and sustainable life. It improves well-being and social life for everyone. This system, as I told you in the beginning, is based on 3 layers. I can go through that very quickly. And the social platform with governmental funding from the state budget, and it is based on the personal eligibility and inclusiveness. This is for all individuals, unemployed, employed, people with disabilities, orphans, widows, old age, and childhood. There are two benefits that are not empowered, the job seekers and the maternity. The second level is the social insurance, the pension scheme. It is a contributory scheme, and it guarantees old age pension, disability, occupational injury, occupational safety, and maternity leave, etc. As I told you, under previous challenges, there were some groups that were not covered, and now even the groups that of non-Omanis are also covered by the maternity leave, and the occupational injury will cover them in 2028. Some sectors that are not formalized were not covered by the social protection in the current law, and there is also the compulsory insurance for the self-employed. There is an additional layer or level. Please, if you can be short, and then you can have additions in the second part. Okay, no worries. In a nutshell, the main motive is the vision, the inclusiveness, the multi-layering, and there are also complementary and voluntary schemes for Omanis and non-Omanis. Thank you so much. I think time is up. I, of course, have many other things to say. I'm sorry to interrupt, but I wanted to make sure to allow everyone to speak, and I hope you will get the opportunity to say more later on. I'm sorry again. Let's now move on to the friend and the colleague Ibrahim Abdullah, who is the president of the Lebanese Universities League of the Blind and member of the National Council on Disability in Lebanon. Mr. Ibrahim, based on your experience, what are the main structural challenges that still prevent access to social protection, the right to social protection for the people with disability, and how can we adopt a right-based approach based on the effective participation and accessibility, and how can that help address the different gaps in Lebanon? Of course, we're asking this question to you because Lebanon is one of the countries that have achieved steps forward in the recent years. I mean by that the design and the implementation of the monetary allowance for people with disability in 2023, and it proved to be useful in many cases. So how how did this program evolve, and how can we really benefit from this experience? How can we understand in terms of the coverage, the targeting, and the implementation, what are the potentials that we have in Lebanon in order to develop our social protection scheme to move on to a more just and right-based system? 5 minutes, please. Thank you, Farah. Let us start with the structural obstacles. And now we are facing one of the obstacles. I did face obstacles in terms of accessibility to join you. And that's why I'm using my phone. Anyway. This is Rewa. Ibrahim logged in through my phone because he wanted to overcome the accessibility challenge. Hello, Rewa. Thank you, Ibrahim. Unfortunately, we still hear of such challenges. We're sad to hear that. We're all ears. Go ahead. Persons with disability encounter several challenges that prevent them from benefiting from social protection programs in Lebanon. Under challenges, the limited data because a lot of persons with disabilities are not officially registered due to the complexities and the medical eligibility standards, as well as a lack of updated disability-related data, which makes it difficult to target them and social protection programs. And the right-based approach is based on moving from depending and relying on medical records to occupational and integrational tools, while fostering registration at the local level. To adopt people with disability social security program based on a medical assessment that do not take into consideration the needs of people with disability, while the disability card is considered an essential condition to have access to social protection services. The obstacles pertaining to communication and accessibility, which means there is limited accessibility to places of application and service delivery because of the transportation issues, equipment issues, and the lack of Braille, sign language tools, and simple languages. While the inclusion and accessibility principles would require making services and data available through different channels that can be easily accessible, such as digital tools and partnerships with organizations of the people with disability. The institutional fragmentation, which means that roles and responsibilities of social protection can be found in different programs and ministries, which results in gaps and redundancy. The right-based approach seeks to establish governance frameworks and mechanisms of accountability. The limited participation of organizations of people with disability because policies are designed without active consultations with such organizations, which weakens trust in such policies and participation in the program design. Follow-up and assessment, which would contribute to trust building and guaranteeing that they fully respond to the needs. The financial limitations and limited sustainability, such as the budget limitations, which impact the benefits and the level of coverage. And the right-based approach encourages a progressive accessibility to rights. The right to social protection by linking up the national cases with sustainability on the long run. The monetary allowance is a program that aims at providing monthly support to all persons with disability.
So it was launched by the Ministry of Social Affairs in 2023 with the support of partners such as UNICEF, ILO, and this created a transformation towards acknowledging the financial support as a right and not as charity. Among the elements that emerged after the use of this program, the extension of using the registration mechanisms and digital verification to reach the largest number of people, strengthening communication and cooperation with local organizations to enhance integration, enhance transparency gradually in order to identify the payment mechanisms, advocating the efforts to move from offering urgent assistance to offering institutional disability allocation and enhancing sustainability. Finally, this human rights-based approach and participatory approach contributes to addressing the structural challenges through designing an inclusive system and acknowledging people with disabilities. Thank you. Thank you very much, Mr. Ibrahim. Thank you also for abiding by the time. I wanted to have a comment without saying much because I also want to hear more from those present with us. So, Mr. Mohammed from Egypt, I would like to ask you the following question. When it comes to extending the coverage in Egypt, what were the institutional priorities for the Solidarity Ministry? And what was the executive process that you are adopting towards achieving comprehensive coverage, especially when it comes to marginalized or vulnerable groups, such as the informal workers, women with disabilities, people in the rural areas, etc. And can you also please tell us more about the lessons learned and when it comes to supporting this extension while preserving sustainability? So to which extent this framework is helpful or not? I will be very quick. So when it comes to extending the protection network, Egypt can be a pioneer here or a model. Extending was not only horizontal, but also vertical. So the number of beneficiaries was also increasing in addition to the quality of services. What you're asking me, how is the framework, how can the framework be helpful? Indeed, the legislation. Can you hear me better now? So the human rights approach is mandatory even if the governments change. What are the priorities of the Egyptian experience? In addition, let me give you an example. We have more than 70% of the users in Egypt are women. And women, of course, are they are more exposed to exploitation, and this was revealed in the database. So most of our users are women, and these can be heads of households or other types of groups. Regarding the life cycle, I will give you as an example the latest program we adopted. This was a step taken by Egypt in cooperation with several international partners. It aimed at having a strategy that combines all efforts. And thank God we managed to have a legislation, but now we need to have an executive plan, an execution plan. So this great master plan meant that the services that we offered cover the life cycle. So we have programs that cover people from their day one up until pension lifetime. And we focus on people that have some gaps, such as, for example, informal workers. So this life approach supports these vulnerable groups, or perhaps people who are about to be married, elderly, and other groups that do not pay contributions. So we have some extraordinary or exception-based benefits. These all help us see not only the benefits that we offer, but also the services of other departments in the government. As for the execution part, what are we experimenting and what are the lessons learned that I can offer you? As I've told you, we are done with the legislation. We have now a plan. But let me be honest with you. The repercussions of all these great achievements at the execution level suffer from great hurdles, and the results are not always ideal from day one. Nevertheless, what we can say is that governments should be accompanied by administrative flexibility, by human resources. And this is why the law that we adopted categorized the different kind of communities up until the rural level. And it also included an effective way for holding people accountable. So it is not only the ministry that should verify the users, we also have other departments such as control departments, the yearly inspection, etc. Another point that was a challenge to us is the large number of potential users that are invisible. We can say, for example, that they are invisible on the radar. So these are informal workers that are concentrated in the rural areas, and they are not visible to the system. However, the mitigation approach started with having an electronic link to link all those existing in Egypt to one network so that we could verify what users are saying. In addition to that, we also have a database. The database today includes half the population of Egypt, either those who were ejected or those who are indeed benefiting from the system, or those who are former beneficiaries. Regarding the lessons learned, can you please just mention them and be quick? Programs that were transformed into laws. This enhanced sustainability. Because this regards the changing governments. We just have now a law. Also, the digital structure is the main element to deal with this large number of beneficiaries, especially in Egypt. We also have the idea of extending our coverage not only with the measures but also with raising awareness, because we discovered that it's not about doing the right programs only, but we also had a problem regarding the awareness of the system applied itself. So I hope we would have more time to discuss these ideas. And if you have any question, I would be very happy to answer them. Thank you very much for all this information. Now let us go back to Oman with Mrs. Radia Al-Mahrouqi. Mrs. Radia, how does the Social Protection Fund in Oman, how does it activate a comprehensive methodology in a way that allows you to organize or coordinate in a better way? And how does it allow you to maximize its impact by achieving social welfare, economic and social empowerment that Mr. Midhat talked about? Thank you. Go ahead. As I mentioned in the beginning, so the strategic national framework is already established in Oman, and this is all organized already, and this facilitated many things. Now we are focusing on strategic projects that are very important. They focus on multilateral coordination in a way that allows us to have a social protection policy that includes all policies related to the social affair ministry. So these policies would be complementary and would be included under the umbrella of our ministry. Today, we're also working on a very important project with ILO and UNICEF when it comes to impact measurement and having a national plan or a strategic framework to having several evaluation standards or measurement standards. This will help us measure the impact of our programs and make new decisions in this regard in order to achieve the sustainability of our programs. We also have a project to document the social protection law because as I've mentioned, this is still a modern law. It has been enacted for 2 years only. This is why we decided to document it and to evaluate it in order to enhance it. We are also working on having a complementary framework for complementary services in order to ensure that beneficiaries are receiving a complementary package of support and enhancing their life cycle. By enhancing the services offered to children and people with disabilities. We are also working on a very important project, which is the sustainability of benefits. And this is funded by the government and the Treasury. So we are working on ensuring its sustainability by ensuring that that our system is capable to respond to any crisis. And we are working on evaluating the impact of social protection. Thank you. I hope that I didn't take much of your time. Not at all, and thank you very much because we are running out of time. So thank you very much, Mrs. Radia. And now let us go to Mr. Ibrahim Abdullah, and he will be talking to us about the situation in Lebanon. We would like to hear from you more regarding the situation of people with disabilities, and especially when it comes to the program of monetary allowance. So how can we have a more comprehensive, a human rights-based system that would restore trust in the Lebanese institution? Because our problem in Lebanon is the lack of trust. Indeed, it is a lack of trust and not a little trust. So how can we restore this trust, especially among the vulnerable communities such as people with disabilities? Of course, you would tell us that this program has helped to restore this trust, and perhaps not. We would like to hear from you tangible steps that would help us to, improve transparency and accountability and restore trust among citizens and institutions. Go ahead, Mr. Ibrahim. Thank you, Farah. Restoring trust with public institutions in Lebanon, especially among people with disabilities, requires several measures, including having transparent and clear standards. And indeed, the Monetary Allowance for Disability program has helped having clear measures to registrations, evaluations, and paying the dues. Because when the users understand how decisions are made, but when they know how, when they ignore how these standards, excuse me, when they know how standards are implemented, the trust is automatically increased. Second, So paying regular payments, because trust, depending, or the trustworthy element is a very important element, and it would increase trust in public institutions. Paying these payments regularly and without any delay through systems run by the Ministry of Social Affairs is indeed very important. And this will be supported by technical support from partners such as UNICEF, ILO, and the World Bank. This would ensure um, that institutions are abided by their commitments. The participation of disability organizations is very important as well, because this participation would contribute to communication efforts. It is very important as well to collect feedback and to monitor their ownership and how well they are committed to their programs. When vulnerable communities notice that their feedback is included in the programs, trust will be increased in public institutions. Enhancing communication and awareness, because evaluating evaluating public information would lead to explaining this program or the monetary allowance for disability program. Please go ahead. And also, raising the complaints would limit the misinformation or the disinformation. Accessible communication approaches would mean that institution would look more ready to be inclusive. Also, having complaints approaches or measures that allows people to raise their complaints easily would help them feel that there is more justice. This would enhance the human rights approach. And this will help them feel that the beneficiaries are rights holders and not only just negative or passive beneficiaries that are benefiting from assistance. Moving from urgent assistance to institutional protection. This is very important. Our program is a great milestone that helps us move from short-term humanitarian support to a more organized social protection element. This would mean that the government is working on restoring its role when it comes to protecting marginalized communities, including people with disabilities. This is a major step when it comes to restoring trust in public institutions. Showcase the coordination between national and international actors. Indeed, cooperation among national actors and international partners contributes to enhancing systems and transparency, and enhancing also technical standards. With time, this would enhance the national ownership of these systems, and this is essential to restoring national trust in institutions. Finally, gradual transition towards a human rights-based approach contributes to restoring trust through making these systems more transparent and more participatory, more predictable and inclusive, especially to people with disabilities. Thank you. Thank you very much, Mr. Brahim. And thank you also for abiding by the time. So we're nearly ending our session. However, we have a very important moment, 10 to 15 minutes that we can benefit from by having an open session with all the speakers. Let me start with the first question that is asked by in the Q&A box, a question by our colleague Badr Al-Baridai, and sorry for misspelling your name. I believe that you're asking Mrs. Radia when the research benefit will be paid in Sultanate Oman. Excuse me, when the benefit from unemployed and the unemployed benefit will be paid in Oman. So let me ask this to Mrs. Radia, and I will ask her also another question. Since we're talking about Oman, we are also interested in knowing about financial sustainability and how are you trying to achieve this sustainability from the financial aspect, especially that the largest number of your system is not based on contribution. So what about those who are working in the informal sector? What are you trying to do here to extend this framework and at the same time to ensure the sustainability of those who are covered at the time being and also to extend this coverage? So let's hear your response first and see then if I can ask you another question. Go ahead. Thank you, Farah. Let me answer the first question from Mr. Badr. Regarding the unemployed, actually, this was included in the legislation. The benefits were implemented gradually. We started, for example, with the elderly, the children, and the people with disabilities, because these are those with priorities for us. We also included the orphans and the widowed. We did not activate these benefits since day one, but among our plan, we have also included the mothers, and we've discussed this with ILO so that it would be aligned with their standards. And this will target mothers who are not working, because those women that are already working and have a motherhood or a maternity leave, and this will I think we will need just to have some official endorsement and then we'll go on with the plan. As for your question, Farah, regarding the financial sustainability, we have some part that is covered by the contribution, as you've said, and we're currently working with ILO on having a first study we have already had a first study by 2025, and these the studies include predictions and how much more contributions we will be needing in order to ensure the sustainability on the financial side. We have a team with great expertise in this on this level. As for the part that is not funded by the contribution, this is entirely funded by the government, and we are working on this currently. We are following up on this through our vision, because to ensure sustainability, we need to have a standards framework that shows us where the gaps are, what are the areas that can be improved, and this helps decision makers as well to increase the benefits somewhere or to decrease them somewhere else. This, of course, will be in accordance with our crisis response framework. The Ministry of Finance is also included because to us it is the main source of funds when it comes to protecting the users or the beneficiaries. We also work with other partners and stakeholders because we need a framework that ensures the resilience of our systems when it comes, whatever the crisis, because as you know, we are oil-based state and we are prone to be vulnerable to any crisis that, where it, be it political or not. So we have a series of framework strategies that are constantly evaluated and monitored. Great. It's great to know that you know not only rely on national resources or natural resources to ensure the funding. You have financial control policies, and you take into consideration every aspect. And also, when it is good to know that when you have political will, then everything will be possible. I do not see other questions. Oh, yes, we do have another question from Mr. Musa Hussein. How was the civil society included in drafting the new programs or in evaluating the existing programs? Are there specific tools that were used to consult with the institutions of people with disabilities or the women rights institutions when building the existing systems of social protection or when amending some systems? Let me ask this question to Mr. Abdullah because he knows better about organizations of people with disabilities. Go ahead, Mr. Abdullah. And I also have another question. We in Lebanon, we have an intersective parts of vulnerability because people with disabilities are sometimes informal workers or women or children. So in general, and regardless of the program of monetary allowance, what is the main priority in Lebanon that should be implemented in order to have a comprehensive social protection program? Go ahead. Farah, please give me a moment. Can you please re-ask the question to Brahim because he was disconnected? No problem. So the first question is, how was the civil society included in drafting the new programs or the new benefits or in evaluating the existing programs? Are there specific tools that were used to consult with people with disability organizations or women-based organizations when building or establishing the existing social protection systems or when modifying some systems? In Lebanon, what do you think is the main priority to have a comprehensive social protection program, especially when we need to think beyond the box or beyond the monetary allowance program, because everything is relevant. People with disabilities intersect with other aspects of the vulnerability. So beside this program, what is the main priority that Lebanon should adopt according to you? Regarding your first question, on the participation of civil society, including organizations of people with disability. Today, we have started to think about social protection and the national strategy of social protection. So the first step was to have sessions with ILO, and then we were joined by UNICEF. And we started to talk about the importance to have a national strategy for social protection. With time, the circle expanded. We included unions, civil society organizations, municipalities. So the circle is extended. Everyone participated in drafting the strategy. Unfortunately, it took into consideration many needs of people of disabilities. The first result of this strategy, even before it was implemented, was the monetary allowance program, because it is one of the tools to offer social protection assistance. It wasn't based on needs or on the financial situation of people, but it meant to offer a compensation on what the people with disabilities face as a result of their disabilities. So this was the first step. The program was adopted. It started with a few number of beneficiaries, people from 18 to 30, and gradually it expanded. Today we cover from 0 to 30 and from 65 and above. The program succeeded, many benefited, and today the priorities are, since we have a large number of Lebanese who are with disabilities and they are employees and they rely on social pension, this is why the priority was to help the SS and the Social Security Fund stand on its feet so that it can meet the needs of all these people. As you know, the Social Security Fund suffered a lot during the financial crisis in Lebanon. Yes, thank you very much. I wanted to ask a question to Mr. Midhat as well regarding economic empowerment. However, excuse me, given that we have no more time and that the interpreters will not be able to stay with us, I will not ask this question. But please leave your address or your email in the chat, and if anyone is interested, they will send you a message. Thank you for your understanding. I would like to thank all the speakers, Mrs. Radia, Mr. Muhammad, Mr. Ibrahim, Mrs. Nermin. Thank you for the organizers as well for this session and all the sessions that we're having in partnership with ILO and socialprotection.org. And I had forgotten to say that it's also in partnership with the ISSA. Thank you to all the listeners and participants for their interaction and participants. And we hope that this dialogue was useful to you. Please answer the questionnaire so that we can know more about what you thought about our logistic organization and other points. So please fill in the questionnaire and see you in the future in the next series, and we will let you know soon of the date. Thank you very much. Goodbye.